assessed the manifestos based on what the dialogue expected. And I remember that day while walking out of the studio, Titus is my friend. I met Titus downstairs with Dr. Siasari, and I was laughing at them, and I said, you people have put proposals, but you didn't test the proposals against what the dialogue said. And so for me, when the bill was passed by Parliament, the first thing I did was to marry the bill against the outcomes of the stakeholder dialogue that Multimedia held. Because you had the patients on, you had government on, you had the health professionals on, and you had advocacy groups like myself on. And so when you look at the bill as passed, it satisfies all the requirements that the stakeholder consultation was looking for. Why do I say that? We wanted a ring-fenced funding. Now the government has said 20% of NHIS, so we exactly know where the money is coming from. And when you talk about ring fence, it means it has to go to an entity that technically is out of the reach of government. So a trust fund has been set. That's another thing that Dialogue asked for. So that has been done. Number 3, it had to be managed on behalf of the patients. So a board has been set up. That has been done. And number 4, there had to be sustainability. There is an index to say 20% of NHI, even though I have a problem with the funding model, and we'll come to that, but I'm just going by what the dialogue agreed. Sustainability. So you know that whatever it is, when the NHI funding is agreed and approved by Parliament, 20% of that goes to management of chronic diseases.